Hi, my name is Akila. I am a nursing student at Aspen University, and I am doing a presentation on Module 4 for the Pharmacology class. In the first portion, the scenario with the patient that was brought into the emergency room, based on my first impression of this patient's actions and appearance, I suspect that she is suffering from alcoholism and potentially withdrawal. Based on her actions, she does have an unsteady gait. She's argumentative, combative, disoriented, and it appears once again that she may be suffering from alcoholism. A blood alcohol content test can confirm if she is in fact intoxicated. In addition, she is shaken severely, which is consistent with tremors. She is verbally stating that she needs a bottle. It appears that she is experiencing some form of withdrawal from alcoholism based on how she is presenting. A person that is withdrawing from alcohol, it can be life-threatening. Withdrawal signs and symptoms include anxiety, insomnia, and seizures. Delirium tremens, or DTs that some may refer to it as, may also occur to individuals who have suffered with long-term alcoholism. When a person is experiencing DTs, they will exhibit confusion, disorientation, agitation, hallucinations, anxiety, panic attacks, formication, which is the feeling like something is crawling on the skin, as well as paranoia. Short-term and long-term health risk that I would expect that this particular patient in this scenario may experience is her liver is of concern. She may experience some cirrhosis of the liver, as well as jaundice that goes along with that. Long term, the liver may fail if she continues consuming alcohol for the long term chronic alcohol abuse. And unfortunately, once the liver does become impaired, the function of the liver decreases, and a high risk of blood clots and malnutrition does become a factor. It mentions that the patient's hands are shaking and that she is confused and combative. I believe this again is related to the alcoholism. Alcohol is a central nervous system depressant that crosses the blood-brain barrier. A person that is under the substance of alcohol may feel the effects within 5 to 30 minutes after consuming it. The effects that a person has in response to alcohol is based on the amount the person has consumed, the type of alcohol, if the person has eaten any food, or if they are male or female, as well as the person's BMI. In addition to these factors, a person's tolerance to alcohol may also play a role in their level of intoxication. A person who has eaten will slowly absorb alcohol, so they may not feel the effects as soon or if at all. If they have not eaten, they may feel the alcohol quicker. In addition, when it comes to the serving size of alcohol, people don't realize the actual serving sizes. For example, 12 ounces of beer is the same serving as 1.5 ounces of hard liquor, such as a brandy. Alcoholism is metabolized by the liver, and it will metabolize about 15 milliliters per hour. So if a person is having, say, a 12-pack within a certain amount of time, or if every evening, it's going to take over 6 hours on average for the liver to metabolize them, so they're going to feel those effects for that long. But if that person has a higher tolerance, they may not necessarily feel those effects. As far as assessments for this particular patient, alcohol may have both psychological as well as physical effects on the body. And I've already gone over the signs and symptoms, but if a person overdoses, they may not realize how much they are consuming. If they have a lethal amount of alcohol in their system, they may vomit, have severe hypotension, respiratory failure, as well as suffer from depression. With a high consumption of alcohol, more depression effects can occur and therefore should never be combined with any other central nervous system depressants. A person who suffers from alcohol abuse should undergo a psychological evaluation. Again, if they're dealing with some depression, you want to make sure that you stay on top of that so that they don't intend to harm themselves, whether intentionally or unintentionally. A neuro assessment for this particular patient should also be done. She did have a witnessed fall, and you want to make sure that there's no type of traumatic injuries that occurred as a result of that. A neuro assessment would also be helpful in determining the patient's baseline. Maybe there may be family that may come talk to her or may come visit her, and you want to know what her baseline is so you can kind of assess to see where she is at now. Alcohol treatment should be discussed with the patient. There are many forms of treatment that's available. It may include support groups, behavioral counseling, or medications such as benzodiazepines, Valium, Librium, Campral, or naltrexone. Now, when it comes to mental illness and management of mental illness, there is both pharmacological and other therapeutic methods available for treatment. A person that is seeking healthcare services for mental illness may unfortunately experience some challenges getting timely as well as adequate treatment. Mental illness can be managed by both pharmacologic methods as well as therapeutic methods. To be diagnosed with a mental illness, a patient must be diagnosed by a psychiatrist. The psychiatrist will then create a treatment plan. Both private and public health insurance policies, unfortunately, do not provide the best services geared towards mental illness. Health insurance has managed mental illnesses by having a third party or different healthcare policy handle that portion of the services. Oftentimes, when a patient is requesting services, they may be experiencing a critical and crucial time, including a mental breakdown. It can be challenging to schedule an appointment with a qualified mental health professional. Oftentimes, they may state that they are not accepting new patients, or may be a few weeks to a few months until the patient can receive an appointment. If that's the case and they are having a medical emergency, a mental illness emergency, they will be directed to a hospital emergency department. However, that is only a short-term resolution. I thank you for your time, and thank you for listening to my Module 4 presentation with Aspen University. This is Akila Bell.